Beyond the generous donations that Community Medical Centers has received, the supply chain team continues to work diligently to purchase large orders of extra masks and personal protective gear to ensure every healthcare worker stays safe while taking care of patients. This is just one area where hospital gear is being stored and prepared for distribution. Stephanie Quinto is the contract coordinator for supply chain management at Community.
So I negotiate contracts. I'm also on the value analysis committee for patient care and peri-op. So we push compliance and then look at ways to standardize and drive efficiency.
Tiffany is in charge of purchasing personal protective or PPE equipment like masks and hospital gowns, now more important than ever.
I also require a sample, so that way we can evaluate it and vet it and make sure that it really is a legit surgical mask and that it'll provide our nurses the protection they need to care for our patients.
That vetting process is especially crucial during this coronavirus crisis. Tiffany goes above and beyond to ensure the products they order are optimum, making sure the masks follow the standards of the American Society for Testing and Materials, that they are fluid resistant, and they filter out the amount of air needed to keep healthcare workers safe.
My number one concern is to make sure that the products that I order provide enough protection for our nurses who are dealing with the COVID-19 patients.
Her priority is also to guarantee Community's facilities have enough PPE. It hasn't been easy during the global pandemic, as medical supplies have been in short supply around the world. Tiffany explains Community staff normally goes through 10,000 masks a month, but now,
on average, if we were to go through universal masking throughout the entire corporation, it's estimated at about 10,000 masks a day. I've been put into a role to where I need to contact third-party suppliers to try to find additional resources to get masks and isolation gowns and hand sanitizer, because the large distributors have put everybody on allocation. So let's say our standard mask usage was 10,000 a month, and that's all we're going to be getting. So the influx of patients means we need an influx of supplies. So that's my role, is finding third-party suppliers to get product from.
Tiffany says they don't anticipate running out of masks.
We work day and night to make sure that everybody gets the PPE that they need. I have over 50,000 to 100,000 masks that are going to deliver this week, so that way we can go forward with universal masking across the facility.